Just published August 14th, 2025, the American College of Cardiology and the American Heart Association's newest guideline on the prevention, detection, evaluation, and management of high blood pressure in adults. There are 10 top take-home messages, so let's get started. High blood pressure is the most prevalent and modifiable risk factor for the development of cardiovascular diseases. The overarching blood pressure treatment goal is less than 130 over 80 for all adults, with additional considerations for those who require institutional care, have a limited predicted lifespan, or are pregnant. Clinicians should collaborate with community leaders, health systems, and practices to implement screening of all adults in their communities and implement guideline-based recommendations regarding prevention and management of high blood pressure to improve rates of blood pressure control. Multidisciplinary team-based care is effective in assessing and addressing patient access to medications and other structural barriers to support individual patient needs and thereby reduce barriers to achieving hypertension control. Blood pressure is classified by the following framework. Normal blood pressure is defined as less than 120 systolic and less than 80 diastolic. Elevated blood pressure as 120 to 129 systolic and less than 80 diastolic. Stage 1 hypertension as 130 to 139 systolic or 80 to 89 diastolic, and stage 2 hypertension as greater than or equal to 140 systolic or greater than or equal to 90 diastolic. For all adults, lifestyle changes, including maintaining or achieving a healthy weight, following a heart-healthy eating pattern, reducing sodium intake, increasing dietary potassium intake, adopting a moderate physical activity program, managing stress, and reducing or eliminating alcohol intake are strongly recommended to prevent or treat elevated blood pressure and hypertension. Initiation of a medication therapy to lower blood pressure in addition to lifestyle interventions is recommended for all adults with average blood pressure of greater than or equal to 140 over 90 and or for selected adults with average blood pressure of greater than or equal to 130 over 80 who have clinical cardiovascular disease, previous stroke, diabetes, chronic kidney disease, or increased 10-year predicted cardiovascular risk of greater than or equal to 7.5% defined by PREVENT. In adults with average blood pressure of greater than or equal to 130 over 80 and at lower 10-year cardiovascular disease risk defined by PREVENT of less than 7.5%, initiation of medication therapy to lower blood pressure is recommended if average blood pressure remains greater than or equal to 130 over 80 after an initial 3 to 6 month trial of lifestyle modification. For all adults with stage 2 hypertension, the initiation of antihypertensive drug therapy with 2 first-line agents of different classes in a single pill, fixed-dose combination is preferred over 2 separate pills to improve adherence and reduce time to achieve blood pressure control. Home blood pressure monitoring combined with frequent interactions with multidisciplinary team members using standardized measurement and treatment protocols and home measurement protocols is an important integrated tool to improve rates of blood pressure control. Reliance on cuffless devices, including smartwatches, for accurate blood pressure measurements should be avoided until these devices demonstrate greater precision and reliability. Severe hypertension in non-pregnant individuals defined as blood pressure greater than 180 over 120 without evidence of acute target organ damage should be evaluated and treated in the outpatient setting with initiation, reinstitution, or intensification of oral antihypertensive medications in a timely manner. And there you have it. Make sure to check out the full guideline from the American College of Cardiology and the American Heart Association and other related clinical decision support tools at guidelinecentral.com.